Now let's talk more about the ECG leads. If you see here, these things pasted in this man's body, these are ECG leads. Now you just cannot place any leads at anywhere. Each lead has a specific name and it has specific location to be placed on. Now what we use nowadays is 12 lead ECG. If you see this paper, it has 12 markings. These are the 12 corresponding leads. If you see here, these waves are pointing upwards. But just see this wave and this wave. Both look same except these waves are pointed downwards. I'll just tell you why in a minute. This is normal. Now I told there are 12 leads. These are lead 1, 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, V5, V6. Now let's see where are they placed and what do they do. If you see, I told there are 12 lead ECG. Let's divide it into 2. 6 plus 6. 6 leads are placed in a manner from top to bottom. And other 6 leads are placed in a direction at which cross section of the heart. So 6 leads from top to bottom and 6 leads the cross section of the heart. Since heart being a 3D structure, we have 12 leads placing from every direction to note the activity of the heart. If the leads are placed properly, you will get the correct reading for that patient. If you change any lead, there could be no problem in the patient, but your ECG could show some other problems. So that is why it is important to know where to place the leads. Now, for example, you are working in the emergency department and there a patient comes. You are being asked by your senior resident to place the ECG leads. Now, let's see where to place them. First, know that the heart is first know the location of the heart and the direction in which the current passes. Then you have to place the AVR lead, that is augmented vector right. This AVR lead is being placed at the right limb. Then AVL at the left limb. Then AVL at the left limb and AVF at the foot. AVR, AVL and AVF. Then in between AVR and AVL there is lead 1. This lead is not being placed. It's just the potential difference of these two leads. Lead 2, potential difference of AVR and AVF. Lead 3, potential difference of AVL and AVF. Then V1 is being placed at the 4th intercostal space, the right parasternal border. The V2 is placed in the 4th intercostal space, left parasternal border. And V4 is being placed at the place where we check for the apex beat, that is 5th intercostal space, left mid-clavicular line. V3 is placed between V2 and V4. V5 is being placed at the anterior axillary line and V6 at the mid-axillary line. Now, I told that few waves are being pointed down. This is because you can see here there are several leads placed at the several places. Each lead looks at the heart from a different direction. For example, the current is being passed downwards. But if you see AVR, it's in the opposite side. So these waves are shown opposite, that is pointing downwards. So if in AVR, if the waves are pointing downwards with normal rhythm, that is normal. If you see here the AVF, lead 3, they are all in the direction of the current. So you can see these are pointed upwards are normal. So that is why some of the leads are point downwards. It's just because they are placed in the opposite direction of the passage of current. Now let's talk about the limb leads. There are 6 limb leads as mentioned before: lead AVR, AVL and AVF, and their potential differences: lead 1, 2 and 3. These 3 are limb leads placed from top to bottom. Then there are 6 chest leads. These leads are also called as precordial leads, before the heart. They are placed in front of the heart. These are V1, V2, V3, V4, V5, V6, and I just told their respective locations. Now let's see some special leads. There are bipolar leads, lead 1, 2 and 3. Bipolar means 2 poles. If you see here, lead 1 has 2 poles, AVR and AVL. Lead 2 has 2 poles, AVR and AVF. Lead 3 has 2 poles, AVL and AVF. These are just the potential difference of 2 leads. So they are called as bipolar leads. All other leads are unipolar leads. Let's see about what do each leads do in the abnormal patterns of the ECG. Like if you see, lead 2, lead 3, lead AVF are placed in the inferior side of the heart. So if there are any problem in the inferior side of the wall, wall of the heart, these leads will be abnormal. The inferior wall of the heart is supplied by right coronary artery. So if you have a myocardial infarction of the right coronary artery, the inferior wall leads would show the abnormal patterns in the ECG. So we can easily know that which artery is damaged and which part of the heart is damaged. That is the significance of ECG. Then lead 1 and AVL. These are at high lateral wall, which is supplied by left circumflex artery. Then V1 and V2. They are the septal wall, supplied by left anterior descending artery. V3 and V4 at anterior wall of the heart, left anterior descending artery. V5 and V6 at lateral wall, left circumflex artery. If you see here, when there is myocardial infarction at any part of the heart, that respective lead will show the abnormality in the ECG. So we could easily locate which artery is damaged and which part is damaged, and we can do the treatment accordingly. To know more about the arteries and veins of the heart, you can see my other videos.